Good afternoon, everybody, and welcome to Tipping Point Media's Experiential Learning for Patients and HCPs using virtual and augmented reality. We're very excited for today's session. We're going to show you different techniques and strategies you can utilize virtual and augmented reality for. So let me introduce you quickly to our team. My name is William Garner. I'm the President and Chief Creative Officer of Tipping Point Media. We've been in business now for 17 years, developing virtual solutions for the medical device, biotech, and pharma-related industries. And we're very excited for this. And let me, without further ado, introduce you to Sean and Elena. Sean?
Thanks, Bill. My name is Sean Purcell. I'm Director of Business Development here at Tipping Point Media. I really look forward to today's session and sharing some of our experiences with augmented and virtual reality with you.
Hi, this is Elena Korst. I'm a Senior Solution Strategist at Tipping Point Media, and I'm really looking forward to sharing some of our client success stories with you.
As we all know, marketing enables pharma companies to identify, anticipate, and provide solutions for customers' requirements. New technologies like AR and VR can support marketing in these initiatives. In today's session, we'll show you how to use these immersive qualities of virtual reality and augmented reality to create learn-by-doing experiences. These two virtual tools we'll be discussing today are virtual reality and augmented reality, and how these can be used to build visceral journeys for your user. Both these technologies can transport the user to any location we can imagine, from inside a doctor's office down to the cellular level of a patient's body. These state-of-the-art applications allow users to see, hear, feel firsthand what the HCP and patients experience on a level impossible with any other technology. First, virtual reality. It is a 100% 3D generated experience that immerses the user in a 360-degree experience. Typically, this technology is viewed in a headset like the Oculus Quest, but many may not know that you can also experience virtual reality on your iPhone or tablet device, making it easier to disseminate. Second, augmented reality is a mixture of virtual and the real world. It produces a lifelike 3D model that the user can interact with on multiple levels. A 3D model could be any part of the human anatomy or a life-size HCP or patient standing in your living room that you can have an engaging conversation with the help of voiceover and artificial intelligence software. Okay, now I'd like to pass it off to Sean.
Thanks, Bill. Let's start out by taking a look at empathy and its role in healthcare marketing. Empathy extends far beyond a patient's medical history, signs, and symptoms. It's more than a clinical diagnosis and treatment. Expressing empathy is a highly effective and powerful tool which builds patient trust, calms anxiety, and improves health outcomes. Research has shown that empathy and compassion will be associated with better adherence to medications, decreased malpractice cases, oftentimes leads to fewer mistakes, and increases patient satisfaction. Expressing empathy, one patient at a time, advances humanism in healthcare. This strategic approach of utilizing empathy shows respect and resonates with the patient that oftentimes can feel sensitive about their current situation. It makes an emotional connection to the patient that allows them to feel comfortable with the brand's understanding of their perspective. In return, this is an effective way to educate patients, drive traffic, and increase brand awareness and loyalty. Now let's take a look at virtual reality in patient engagement and education. While augmented reality and virtual reality are still somewhat new technologies in the marketing and education space, more and more studies are being conducted to prove what we know all along. And that is that augmented and virtual reality are really effective tools for learning and engagement. This is a great example of virtual reality being utilized to engage with an older generation of patients. In this study, a team developed a 3D model of an abdominal aortic aneurysm for patients with a diagnosis to view it in VR. The interesting part of this study is that the median age of participants was 69 years of age. And it's often a misconception around this older generation that they are not open to or cannot utilize virtual reality like a younger generation can. But the interesting results in this are that 89% felt better informed about their healthcare status after using virtual reality and would like to use more virtual reality in their healthcare. 84% felt more engaged about their healthcare because of the VR. 90% felt comfortable utilizing virtual reality, and 84% really enjoyed the experience that they went through. So what do we learn? Well, VR proves to be an engaging learning tool that patients perceived as a beneficial tool in understanding their healthcare status. And another key point to this is anytime you're choosing your virtual reality vendor, be sure that your virtual reality vendor understands your patient better than they understand their technology, because this is where you can begin to see those types of results with your older populations. Okay, so how do we develop empathy utilizing augmented and virtual reality? Virtual reality and augmented reality has a unique ability to allow users to experience any situation from any point of view. Having the ability to walk in the shoes of a patient will provide a deeper understanding and make a better emotional connection to that patient. We now have the ability to design immersive experiences for multiple patients, caregivers, and HCP perspectives. The collective experience offers the power for an individual or group to simultaneously share the experience with their family, friends, colleagues, so that they can better understand and enhance their emotional connection back to the patient. This virtual reality experience at its core uses sensory stimulation and replaces a user's reality with a new one. When we design experiences around the plight of the patient and create an experience that makes the patient feel understood and heard, we design with empathy and humanization in mind. Healthcare tech and devices have the power to meaningfully change and upend behaviors because it motivates the end users. Customers have needs, and brands have to find new ways to fulfill them. And there are several ways that we can develop empathy for the patients through the use of these technologies. For example, we can create a visual effect such as the effect of AMD has on a person's vision by slowly increasing astigmatism in someone's eye and asking them to perform their daily tasks. The astigmatism will increase with the person going through and manipulating things inside their environment and become harder and harder. And that actual person will be able to feel the frustrations of what it's like to be going through their day with that stigmatism. For example, too, we can also increase a user's anxiety and stress level by speeding up background noises or adding a rhythmic tone to mimic the onset of a migraine. We can take this even one step further and add all of these together to mimic pain. We can use a haptic feedback on an iPad and controllers, in addition to visualizing sound effects to mimic a pain increase in the patient. For example, a patient experiencing rheumatoid arthritis can be given a simple task. Let's say it's stirring a pot. And as a person stirring that pot, we can mimic pain through shaking their controllers, making it hard to hold the spatula. We can start to flash an audible red. We can increase a loud audible tone to mimic the frustration and the pain that person's going through. So in terms of creating a lasting memory for users, the use of sight, sound, and touch leads to a very visceral experience that will create a lasting memory that will last with users for a long time. So how do we develop empathy with storytelling? Well, I'm going to pass it on to my colleague, Elena, and she's going to talk to you about that.
Thank you, Sean. Oftentimes, doctors see a wide range of symptoms throughout their day, and they can all become a blur. So the use of empathetic storytelling to make connections and inspire doctors removes the clinical book learning element and builds retention by putting faces and stories to case studies. Patient advocacy pieces bring to life a patient story, giving it emotion and creating that lasting memory. The journey can be seen through the lens of a specific customer, such as a patient, a physician, a caretaker, or even a loved one, as they work through diagnosis, treatment, and lifestyle changes. In the upcoming demo, William will walk us through how various treatments are used to compel the audience and draw them into the story, enabling us to understand not only a patient's frustration around the loss of an active lifestyle, but their daily struggles with basic tasks.
Okay, thank you, Elena. So what we're going to show you guys now is an empathetic storytelling approach that is developed in virtual reality. What makes this very special is you first meet the patient, you hear their story, you build empathy around that, but then you're turned into the patient and you're feeling it firsthand how hard and difficult it is to climb this wall. So without further ado, let me play this quick demo for you.
I've always been an adventurous person, even as a little kid. Between sports practice, guitar lessons, student council, And my favorite activity, rock climbing. Well, let's just say my childhood was never boring. But once the semester started, I was quickly overwhelmed. Trying to balance friends, clubs, and classes with studying was difficult. Sometimes I wouldn't leave the library until 4 a.m. I was so tired all the time.
Ready to beat your time?
I'll try.
All right, here we go. Remember, one after the other. You got this.
I'm so tired today. It feels like I'm climbing a mountain.
Do this. Keep going.
I don't think I can lift myself up.
30 seconds. Keep pushing.
Many climbing sessions left me frustrated and tired, which made me even less motivated to go to the rock gym. Eventually, my coach picked up on my grab-and-go eating habits and offered to help me balance my diet. He recommended some healthier meal options that could work with my busy schedule, and even suggested I try a few probiotic dietary supplements. Setting the time aside to eat right and get a good night's sleep was tough, especially with finals around the corner, but I managed to stay disciplined. And by the second semester, I finally began to feel like my old adventurous self. I can do this. I know I can. I'm almost there. Just a little bit higher. So close. I made it!
That's a new personal record. Great job. I knew you could do it.
Yes! I did it! I finally did it! Yes!
I hope you enjoyed that demo. Oftentimes, empathy can be developed through a greater knowledge of the symptoms and underlying causes of a disease. This knowledge can be the catalyst that gets a patient into a specialist faster, maybe into a clinical trial, or exposed to additional treatment options that may not have been uncovered otherwise. AR and VR can bring an HCP into a virtual world that presents the disease in a way they've never seen before, adding to their knowledge of the disease and bringing more refined understanding of the discomfort and how the disease affects the body, both internally and externally. In the next two examples, we'll explore the value of diagnostic experiences in AR and VR. In the first example, a client was looking to educate healthcare providers about a disease that is often gone unnoticed because the symptoms of blurry vision and headache are common for a number of diseases. They looked for a way to engage rheumatologists and ophthalmologists on the signs and symptoms of this disease in order to start treatment that would prevent further vision loss. This experience walks them through the diagnostic testing and provides them with a compelling emotional details of the disease progression if it's left untreated. In the second example, we will explore two common diseases of the GI tract, how they're similar, how they're different, and what the active disease looks like inside the body.
Okay, thank you, Elena. So what you can see here, a great use of virtual reality. We can build an ophthalmologist office where you become the one making the diagnosis, all the while experiencing what the patient is seeing. Everything from blurry vision to floaters and you're experiencing that as you interact with the medium in front of you. Another great aspect is we can build a slit lamp where you're going inside the lamp. You're making these deep diagnoses that you can't really do in any other setting. I mean, virtual reality allows you to go into the eyeball itself and see the disease as it's progressing, and you get to experience it firsthand. As you see here, this is another great example of something you can only do in virtual reality that you can't do in reality or a video. And what this is you become a virtual doctor, and you're going around trying to make the correct diagnosis of a patient suffering from Crohn's or ulcer colitis. All the while, you're taking samples, you're taking biopsies, you're scanning, you're doing all this investigation to ultimately come to a conclusion: is this patient suffering from Crohn's or ulcer colitis?
In the next example, we explore a scenario of a patient in a doctor's office discussing their disease, how it impacts their life, and learn more about the best practices for treating this disease. This experience in both AR and mixed reality, a blend of VR and AR, helps to drive healthcare providers into a Congress booth as they witness the event unfold around them. We recognize, as Congresses and other in-person events are on the back burner for a while, clients are looking for solutions. So we're currently working with several clients to move assets like these into virtual booths and e-detailing so that in the new reality, engagement can still occur. We've even converted some of these assets into iPad apps.
Okay, this is a great example of how you can utilize mixed reality for a trade show. But what really makes this dynamic is that we're able to leverage all that mixed reality into an iPhone, iPad app that the users could take home and use in their home office or living room. And what it does is you open up the app and it scans your environment and then places a virtual doctor's office right there in your personal office or living room, basement, wherever you want. And these avatars, doctors, patients, come to life and they interact with you. And depending on how you answer questions, it dictates how they respond to you. We call this branching logic. It's an artificial intelligence which makes it an engaging, interactive experience because depending on how you interact with it is going to dictate how the experience plays out.
As you can see, we're all really passionate about the work that we do with our clients. Another aspect is simulations. Simulations have multiple benefits from a marketing point of view. They can be presented on an iPad, in AR, or in VR. They provide a detailed hands-on experience that can follow a procedural steps of an IFU or provide additional specialized instructions or pearls of wisdom. This serves to support the healthcare provider as a just-in-time training resource that can be easily updated. The elements of a simulation can be utilized at a congress or industry events and even used to demonstrate a procedure to a patient. So how does this play into empathy? Well, this hands-on approach allows healthcare providers to understand and explain the procedure in more detail. They can answer questions more authentically and express empathy to a patient during consultation. Simulations can provide a hands-on approach for healthcare providers, giving them information, helping them understand the IFU, and showing them various procedural tips and tricks that key opinion leaders have provided to make the instrument and the device easier to use. It even provides real-time feedback and information as you go through the simulation so that you can learn and share this with others.
So let's discuss a question we often get. How can we engage HCPs in the new medium? And one of our favorite ways to do this is through the use of AR detailing. This includes self-detailing tools, rep tools, and remote detailing. We now have the ability to drop a 3D patient in the doctor's office with the doctor, or have an HCP step into a patient's home with them. We'll blend the patient's story with science in order to command attention and allow for better retention. And the stats that are out there are supporting this. This is one that we love. AR detailing is providing almost double the visual attention in comparison to your standard presentation tools. and it's seeing about 70% higher retention rate in comparison to non-AR tasks. And we all know HCP time is very limited, which makes it even more important that they're retaining that messaging. This also has the new factor, which helps differentiate your reps in engagements. Would you rather go through a flat detail or be engaged like never before?
Thank you very much, Sean and Elena. Now, it's that part of the session where we open it up for questions.